To talk about that is DuPage County Coroner Dr. Richard Jorgensen. Doctor, I'm sure it's quite easy to tell when you do have an issue because you start seeing bodies. Put it into perspective for us. How bad is it?
Well, we have taken very good tabs of all of the deaths and have noticed over the last weeks that we have had a large uptick in the number of deaths, 2, 3 a day. And yesterday I put out a public service announcement announcing that we had 20 deaths in the last 3 weeks. And to put that in perspective, last year for the entire year, we had 96 deaths.
You say a lot of these deaths are younger than normal, and also there's some similarities with some of them, right?
No, actually, they're a little older than normal. They're 36 average, yes. But in reading the stories and reading the analysis, these are people that are older, but they're also alone, often living alone, often recently out of rehab, having mental health issues, having addiction issues, marital problems, those kind of things. So it seems to be a vulnerable section of our society.
Well, and building on that too, if these folks are by themselves, that's tough as well because there are tools out there for them. I'm thinking Narcan. And,
sure.
And if they're by themselves, then obviously there isn't anyone there to save them.
Absolutely. And the other key thing in talking to my colleagues in the treatment field is all of the treatment modalities and techniques that we have are based on being together and to connecting and having your sponsor and having somebody to help you. And in this environment, all of those things are taken away. So, you know that the typical Alcoholics Anonymous thing is you go to meetings and you're with people to help you. We can't do that now. So it's totally a different environment.
So the COVID-19 virus has definitely something to do with this, you think. What can loved ones, family, friends do? But they're not even around them, mostly.
I think that we know people who are vulnerable. We know people who are depressed and sad and have problems with mental health or addictions. And I think we need to reach out to them. We need to step out and make sure that we call people up or even go in social distancing near somebody so that these people are not alone in their apartments for days on end. In a couple of days, we're going on 2 months worth of a lockdown. And vulnerable people, I think, have a real hard time with that.
Definitely. DuPage County Coroner Dr. Richard Jorgensen, thank you so much. Be safe, be well.
Thank you. Appreciate it.
Up next, the president